Okay, so this is our capstone project. It's called Beyond the Blues, which is focusing on postpartum depression. And my name is Dana Buttree.
I'm Kendall Sabatelli.
And our other group members are Natalie Ober and Caitlin Snow. Although postpartum depression is a known disorder, it's estimated that 50% of women who suffer from postpartum disorder go undiagnosed. The Edinburgh Postnatal Depression Scale, or EPDS, was developed over 30 years ago to be a self-reporting tool for the identification of postpartum depression symptoms throughout pregnancy and the postpartum period. It was found that the postpartum nurses are not educated on how to implement the tool and educate the mothers and their support system on the signs and symptoms of postpartum depression disorder in the home setting. The education tool was developed to increase nurses' ability to implement EPDS and detect early signs and symptoms of postpartum depression while in the hospital setting. This is our Pico question, which is on a postpartum unit, will the educator postnatal depression scale increase the nurse's ability to recognize the early signs and symptoms of postpartum depression disorder?
To answer our Pico question, we used a pre-test, post-test design. We gave a pre-test to the population in question, which is nurses on a postpartum unit, to get a baseline on their knowledge on postpartum depression and the Edinburgh Postnatal Depression Scale. We then educated them on postpartum depression and the use of EPDS on a postpartum unit. To evaluate the effectiveness of the education, we then gave the nurses a post-test to fill out. We tested 20 postpartum nurses from the family birthing unit at Fort Hamilton Hospital. This included a pre and post test that consisted of the same three multiple choice questions and two select all that apply questions, which are: what is the purpose of using the EPDS for postpartum depression patients? When should the EPDS first be implemented? What are some early signs of postpartum depression disorder? What is your role as the nurse regarding the use of the EPDS, and why is it important to educate the support system of the mother on signs and symptoms of postpartum depression disorder? Results from the pre and post test showed a 10% increase in average score after education was received. Overall, the education of the Edinburgh Postnatal Depression Scale was effective as shown by the results. The nurses on the unit reported a better understanding of the screening tool and how to identify at-risk patients. The nurses feel more confident in their ability to provide education regarding postpartum depression.
And here are our references.
Thanks for watching.